slide. So for our biosurveillance updates, we have sequenced 17,893 samples as of October 24, of which 88.76% have assigned lineages. Latest run comprised of 746 samples collected in March, April, September, and October. Of this, 13.94% or 104 were positive for the Alpha variant, 22.25% or 166 of samples were positive for the Beta variant, and 50.94% or 380 were positive for the Delta variant, and one was positive for the B.1.1.318 or a variant under monitoring. Please note that the B.1.1.3.318 was not designated yet as a variant under monitoring during the time of sample collection. Also, of the total sequence samples, incoming international travelers comprised of 1,169 or 6.53%. We are doing retrospective sampling to trace the beginnings of the Delta variant introduction to the country as well as the earliest cases. Next slide, please. Of the 15,882 sample sequence assigned with a lineage as of October 22, 30.3% of samples were positive for the Delta variant, 21.9% of samples were positive for the Beta variant, and 19.2 or 3,042 samples were positive for the Alpha variant. 0.02% or 3 samples were positive for the Gamma variant. Among all the sequence samples in the Philippines, 71.4% of the 15,882 samples with assigned lineages were positive for the Alpha, Beta, or Delta variant. All the 17 regions either have an Alpha, Beta, or Delta variant cases. In NCR, all cities and lone municipalities were found to have a variant of concern. Also, 799 or 68.4% of the returning overseas Filipinos were positive for a variant of concern. On October 24, 5,729 new cases were recorded, bringing the total reported confirmed cases to 2,756,923, of which 2.21% are active cases, 96.27% are recoveries, and 1.52% are deaths. Looking more closely at our active cases, 92.81% of these are either asymptomatic, mild, or moderate, and the total and percentage severe and critical increased to 7.19 or 4,384 cases. For October 24, the top 5 regions contributing to these new cases are NCR, regions 2, 3, 4B, and 4A. The top 5 areas contributing to the new cases are Isabela, Quezon City, Negros Oriental, Pangasinan, and Cagayan. Our epidemic curve shows that cases peaked during the second week of September. The current average daily cases have further decreased to reach our baseline average before cases started to rise back in July. We have recorded 5,251 cases per day in the recent week versus the 5,399 cases last July 29 before the increase in the number of cases. The cases decreased by 32% from the previous week. Nationally, we are at low-risk case classification with a negative 2-week growth rate at negative 48% and a moderate risk average daily attack rate at 5.89 cases for every 100,000 individuals. The national health system capacity is also at moderate risk. All of the regions now with a negative 2-week growth rate and low to moderate risk case classification. 6 regions remains with high risk average daily attack rates. Regions 2, 9, and 5 have ICU utilization rates at high risk. Remaining regions have low to moderate beds and or ICU utilization. The National Capital Region shows a negative 2-week growth rate and a high risk average daily attack rate and is currently at moderate risk classification. The ADAR decreased to 8.56 per 100,000 population in the recent week. Its bed and ICU utilization are at low risk. In NCR, the 7-day moving average shows a decrease as cases in the recent 7 days have decreased compared to the previous 7 days by 500 cases or 35%. The 7-day moving average currently is 945. NCR total bed utilization is on a decline now, currently at low risk at 36% utilization. From July 1 to October 24, the total beds increased by 13% or 1,391. The current occupancy is still higher than the occupancy last July 1 by 12%. Current ICU utilization in NCR is also at low risk at 46% utilization. The current ICU occupancy is still higher than the July 1 by 50%. Along with the decline of our cases, we see that the weekly deaths are also in a downtrend since the start of October. Highest recorded deaths were in August with 5,189 deaths or 167 deaths per day. So our key messages for this week: the decline in cases is seen at the national level and in most regions. However, majority of provinces and cities in CAR, regions 1, 2, 4B, and 9 remain at moderate to high risk case classification with bed or ICU utilization rates at high to critical risk. Measures to sustain the decline are needed as the holiday season approaches and mobility is expected to increase. Adhering to mask and physical distancing and avoiding 3Cs or closed spaces, crowded areas, and close contact activities is most important to prevent transmission. Ramping up vaccination to protect the most vulnerable population, especially our A2 and A3 priority groups. And we should be able to maintain the shortening of our detection to isolation time to control transmission as soon as possible. That's all. Over to you, Jolo.
Maraming salamat po, Yusek, for giving us the national situationer. For our media questions, we go straight to the question of Ana Lu de Vera of the Manila Bulletin. Would like to ask po if the DOH already approved the administration of booster doses for healthcare workers and senior citizens. If yes po, kailan po ito i-implement? Same question with Sheila from the Philippine Star, since HTAC already approved booster for seniors and healthcare workers. And third, for immunocompromised individuals, kailan po ito sisimulan? How many doses are required for this? Same question po from Greg and Lay. Yusek.
Yes, no? So for that question, unang-una gusto ko lang ipaalala na nagbigay naman po tayo ng statement na natin last October 15 regarding this matter. Na ang sabi nga natin, may rekomendasyon na ang WHO and we are just waiting for the completed SAGE recommendations which will be out by November. Ang atin po mga eksperto, katulad ng sabi namin, ay nakapagbigay na ng kanilang rekomendasyon. At ito pong mga nag-circulate na HTAC recommendations and approved by the Secretary, ito po ay nakuha dun sa HTAC website. No? At pinopost naman po talaga yan for transparency. So the Secretary has approved the recommendations of HTAC at lahat po ng plano underway na. Katulad ng sabi namin sa inyo, we will have these third doses for our immunocompromised senior citizens and our boosters for our healthcare workers. Pero kailangan po aantayin pa rin natin lahat yung emergency use authority na manggagaling sa Food and Drug Administration. Kaya antabayanan lang po natin. But while we are waiting for the EUA, we are already planning and discussing on how we can go about with the implementation.
Thank you po, Yusek. For the next question from Greg Gregorio of TV5, may we have an initial assessment for the phase 2 of the pediatric vaccination among 12 to 17 years old with comorbidities? How many children have been inoculated so far and reported adverse events? Are we positive that the phase 3 will roll out in November 5? Another question from Caroline rin po, any update on the adverse reactions among adolescent vaccinees po?
Yes, no? So Greg and Caroline, currently ang atin pong number of children with comorbidities that had been vaccinated as of yesterday was 9,928. So it's 9,928 ang nabakunahan na. At ito naman po ay kino-consider na natin that it was successful, no? Naging maayos po yung ating mga proseso. Yun pong mga reaksyon ng ating mga kabataan mostly were minor. There were anxiety-related reactions. Meron po kami na italang 10 na nagkaroon ng reaksyon. Pero ito pong 10 na ito, 3 mga bata ay nagkaroon ng allergic reactions but were all managed. 3 po nagkaroon ng anxiety-related reactions at yung 4 po, mga minor lang po, masakit po yung mga vaccination site at iba pang mga minor reactions. So far, wala pa ho tayong serious adverse reactions that were noted. But of course, we are still monitoring these children. Katulad ng sabi natin, hindi po natapos yung monitoring namin pagkatapos lang ng bakunahan. We will monitor them for this whole month para makita po natin if there would still be other reactions na mangyayari. As to the question, yung sa November 5, no, meron ho tayong mas mauuna pa doon. Meron hong milestone o timeline ang vaccine cluster sa October 29 kung saan tinataya nila na kung talagang naging successful na itong pilot natin for these 2 phases na ginawa natin, we will then expand to the other regions already. So yan po ay pinagpaplanuhan, pinag-uusapan na po at magbibigay tayo ng information in the coming days.
Thank you po, Yusek. The next question is from Sheila Crisostomo of the Philippine Star. According to PAPI President De Grano, they could feel the low COVID-19 cases in hospitals. They could not feel the low COVID-19 cases in hospitals. Number of severe and critical still increasing. He said maybe data is not accurate. What's the comment of DOH po on this?
Kami po ay nagre-report na, no, simulat sa poll sa ating mga ospital. Ang ating po mga datos nakukuha rin po natin sa ating mga ospital. Ngayon, kung hindi po kompleto yung binibigay nila sa atin, makikita rin naman po natin yan based on realities on the ground. We understand the comments of Dr. De Grano as they also are on the ground. Pero meron din naman po tayong monitoring teams that are going through and monitoring our hospital. So ngayon po, pag tinignan natin, lahat po ng areas dito sa National Capital Region except for Muntinlupa ay nasa below 70% na po ang utilization ng kanilang mga ospital. Ang Muntinlupa na lang po ang nananatili na more than 70%, 75%. In fact, no, yung sa kanila exactly dun sa kanilang ICU utilization. Sa iba pong parte ng ating mga local governments dito sa Metro Manila ay lahat po ay below 70% na. Nakita rin ho natin ang pagbaba ng mga admissions across the different hospitals, not only in NCR, but also in identified areas in the country. At nakita rin po natin that positivity rate is going down. So sa tingin po namin at amin pong inaanalisa, meron pa rin po talagang mga ospital, hindi po natin ikakailaya na talagang meron pang puno ang kanilang ICU actually, no? Meron pa rin iba na mga yung ward beds nila, marami pa rin naka-admit. Pero kailangan natin maintindihan yung dynamics ng admission. Dahil alam po natin na kapag severe and critical cases ang atin pong inaalagaan sa ospital, mas matagal silang namamalagi at mas matagal sila bago sila ma-discharge. Kaya po nakikita natin na baka meron pa rin po talaga tayong mga ilan na mga ospital na talagang marami pa rin po naka-admit. We are not saying that we are out of the woods. We are not saying that we have totally decongested our hospitals. What we are saying as a matter of fact and based from the monitoring and the data that we have right now, bumaba na ang mga na-admit sa ospital. But we did not say na wala na po tayong problema. Nandyan pa rin po yung patuloy nating pagmamonitor at pag-augment sa ating mga ospital.
Thank you po, Yusek. The next question of Sheila is about dinagsa ng tao ang Dolomite Beach. Ano po ang panawagan ng DOH sa City Government of Manila and publiko? Senyales po ba ito na hindi dapat nagluwag sa NCR?
Sheila, hindi dapat nagluwag, ano? Dahil ito naman po, kaya nga patuloy tayo nagpapaalala. Ito pong patuloy na pagluwag natin sa NCR o di kaya sa ibang lugar sa ating bansa o sa buong bansa na, it will all be, we will all rely, no? Dito po sa pagpapatupad natin at pagsunod dito sa safety protocols. So binuksan natin, we were expecting that people will comply with the standards for health, yung safety protocols natin. And not just people. Kailangan yung mga local governments at saka yung mga ahensya natin sa gobyerno, ipatupad din natin ang safety protocols. Meron pong naitalaga na mga protocols ang IATF kung ano po ang dapat buksan. Sinabi kapag ka alert level 3, ang outdoors natin 50% capacity. Yung nakita po natin nung weekend, hindi po yun 50% capacity. Sinabi rin natin na kapag ka nakikita natin na crowded na, may gathering na, hindi na dapat natin pinupuntahan. At ang ating mga ahensya, may responsibilidad kayo to prevent these mass gatherings. Kasi kung ganito lang po ang mangyayari sa atin, babalik po tayo dun sa dati nating paghihigpit. At ayaw po natin lahat yan. So sana lahat po tayo magtulungan. I call on all of our national agencies, whatever was discussed in IATF, whatever safety protocols that we are now implementing, this is for the good of our population to protect public health. Kailangan ipatupad po natin yun. Kung nakikita po natin na hindi kaya, katulad po ng sinasabi ng ibang mga officials na masyadong madami, hindi namin kayang ipatupad, let's regulate that. Hindi po natin kaya, baguhin po natin siguro ang proseso. Pero kailangan po makatulong po namin kayong lahat para po mapigilan po natin uli ang pagtaas ng kaso dito sa National Capital Region and even in other parts of the country.
Thank you po, Yusek, for those reminders. The next question is from Ana Ludevera of the Manila Bulletin. Allowed na po ba ang vaccine mixing po? Similar question to Sheila Chrysostom of the Philippine Star. Approved na po ba ang FDA vaccine mixing and matching? Anong mga vaccines ang ima-match and mix?
Actually, Analu and Sheila, ang nakuha nyo sigurong pag-a-announce kanina yun sa Department of Science and Technology kasi mag-uumpisa na yung study o yung trial na gagawin dito sa ating bansa tungkol sa mixing and matching. So ito po ay clinical trial, wala pa ho tayong binibigay na rekomendasyon para mag-mix and match para po sa mga bakuna natin ngayon. No? So wala pa ho tayong sapat na ebidensya, kaya gumagawa tayo ng clinical trial. So let us try to clear that. Hindi po ito para sa implementasyon para dito sa vaccination program. This is for the clinical trial, itong mixing and matching.
Thank you po, Yusek. Next question is from Donna Kazibugan of the Philippine Daily Inquirer. What accounts for the increase in the percentage of admitted patients or the moderate, severe, and critical cases out of the total active cases? Are hospitals still overwhelmed with COVID cases despite the decline in new cases po?
Yes, no? So naipaliwanag ko kanina, Donna, no? So as of October 23, ang utilization po ng COVID-19 dedicated beds natin nationwide is at low risk at 41.3%. Tapos ang ICU utilization nationwide is 53.26%. You'd also find that kind of data or utilization for the National Capital Region, both below 50% na rin ang ating utilization for ward beds, isolation beds, and for ICU utilization. Kaya tulad ng sabi ko, except for one city here in Metro Manila. Pero pag tinignan po kasi natin, unang-una, kailangan natin maintindihan. As compared to before, our hospitals now are prioritizing admitting moderate to severe patients. Unlike before, it was varied, no? It was a mix of mild, asymptomatic, moderate, severe, critical. Pero ngayon, mas pinabibigyan na ng prioritization, no? Prioritized ang severe and critical. Pangalawa, katulad ng pagkakapaliwanag ko kanina, mas naglalagi ng mas matagal ang severe and critical sa ospital dahil mas matagal sila nakaka-recover. Ang average nila, minimum is 21 days and more kung mas kung hindi pa nila nakaka-recover pa, kaya hindi pa nakaka-discharge sa ospital. So ito po yung nakikita nga natin ngayon, meron tayong 1% decrease in admissions for severe and critical for this past week. Although this is not significant, pero pag tinignan kasi natin sa buong bansa and even here in the National Capital Region, bumaba na po yung admissions. But again, let me reiterate, hindi sinasabi ng DOH na we are out of the woods. Hindi sinasabi ng DOH na fully congest or totally decongest na natin ang ospital. Ang sinasabi ho natin, bumababa na ang admissions.
Thank you po, Yusek. The next question from Donna is, how come the DOH protocol on the use of rapid antigen tests is not enforced? What can the DOH do to stop the indiscriminate use of rapid tests for so-called screening po?
Yes, no. So we are enforcing naman actually, no. And we have partnered with the Department of Interior and Local Government. And actually, ang DILG nagpalabas pa sila ng memorandum sa kanilang mga local governments regarding the appropriate use of antigen test. Kaya lang talaga, ang ating mga kababayan siguro yung sa objective nila at sa kanilang kagustuhan na mas mabilis lumabas ang kanilang mga resulta, they are resorting to the use of antigen. Ang antigen test po, maganda po siyang diagnostic method if used in the proper or appropriate context. So kapag palagian tayo magpapaliwanag at magpapaalala sa ating mga kababayan. Pag ginamit po natin ang antigen test ng maayos, you'll get accurate results. Pero kailangan ginagamit lang siya kapag ang tao ay may simptomas, kapag ang tao ay alam natin talaga na exposed or close contact siya. So kapag ginamit po natin sa mga ganitong paraan, ito po ay magbibigay sa inyo ng accurate test result. Pero pag ginamit natin, for example, sa screening po, sa pagpasok sa trabaho, for example, o kaya sa screening kasi a-attend po kayo ng event, katulad ng kasal, katulad ng mga birthdays na merong maramihang mga taong dadalo, baka hindi po ibigay sa inyo yung tama na resulta. Kaya po kami nagbibigay ng babala or warning sa ating mga kababayan, iayos po natin ang paggamit ng antigen test para hindi rin nasasayang ang ating resources at mabibigyan po tayo ng mga accurate results. Ang pinakadelikado po sa antigen test ay yung false negative na nakukuha natin sa test na ito. Once we will have false negative results, maaring may mga taong nakakasalamuha pa rin natin ngayon, ngunit positive pala sila, pero negatibo ang lumabas sa antigen, kaya po sila ay naging kumpiyansa para lumabas pa uli ng kanilang pamamahay.
Thank you po, Yusek. The next question is from Greg Gregorio of TV5. Cebu City LGU appeals for establishments in the city to be allowed to operate beyond their current capacity. What's the DOH take on this po?
The Cebu City is part of the pilot, expanded pilot implementation po natin. They are on alert level, I think alert level 2 ang Cebu City. So kapag kaganyan po, meron naman po talagang mga further na pagbubukas ng mga establishments kapag kaganyan in indoor and outdoor areas. So meron po, they're part of the pilot implementation. So maitatry natin dun sa kanilang lugar kung ano po yung mga dapat na pwede na mga establishments na magbukas at pwede pang puntahan ng mga tao.
Thank you po, Yusek. The next question is from Red Mendoza of the Manila Times. Sec Galvez said in a statement that the country has defeated Delta. What is your on this, and too premature for the Secretary to release statements habang mataas pa ang mga cases natin?
Lagay natin sa konteksto, no? So sa tingin ko si Secretary Galvez was saying that we were expecting a lot of cases, no, when the Delta variant came in and has affected the Philippines, kasi nakita natin kung paano niya inapekto ang India, kung paano siya nakaapekto sa ibang lugar pa sa buong mundo. And we were expecting talaga na talagang tayo ay magkakaroon ng sobrang taas na mga kaso, tayo ay mau-overwhelm, tayo ay magkakaroon ng maraming pagkakamatay. Pero hindi po natin naabot yung projected number of cases, hindi po natin naabot yung overwhelmed health systems. Although nahirapan po talaga tayo, we were all challenged, pero nakita natin, we were able to reduce the number of cases in about 1.5 months after na pumasok at tumaas ang mga kaso natin from September 5 to 11. So I think, ayun yung konteksto ni Secretary Galvez. Hindi naman po natin sinasabing natalo na natin ng Delta. Dahil ang Delta po na andito pa sa atin, 9 out of 10 of those sequenced here in the country are all Delta variants already, no? So ibig sabihin, nandito na siya sa atin. Pero ang pinakamaganda, we were able to control. We were able to reduce the number of cases at naiayos po natin yung health system natin. And that is what is most important for us.
Thank you po, Yusek. The next question is from Greg Gregorio po ulit, TV5. Rep. Mike Defensor said there are unused 700 gene expert machines donated by the Global Fund for TB and etc. Allegedly due to bureaucratic red tape, questioning why these have to undergo separate licensing for COVID-19 testing when the WHO said TB laboratories may be used for COVID-19 detection.
Yes. Yeah. So unang-una, I like to tell all of you, we have about 900 plus gene expert machines provided by the Global Fund dito po sa country natin. Ang ginagamit po natin ngayon, dedicated to COVID, is about 200 plus machines. Yung 700 po na nabanggit, ginagamit po yan purely for the tuberculosis program. So para po dun sa diagnosis ng ating mga TB patients, yung 700 na gene expert machines. Pero ngayon, since we are trying to shift already dito po sa ating strategies for new normal, atin pong slowly i-win off ang gene expert machines for COVID-19. Pwede nang gumamit yung ibang areas na magkahalo na. No? Ibig sabihin, you can use already the gene expert machines for TB and COVID-19. Just transitioning. Yan na po yung plano natin. Ngayon yung tanong ko kung bureaucratic red tape at kailangan pa ng lisensya na panibago, babalikan natin. Ito pong paggamit ng gene expert machines para sa TB, hindi po yan nililisensyahan. Ang atin pong ipinadaan sa licensing is itong gene expert testing for COVID-19. Kasi bago po itong ating ginagawa for COVID-19, kaya po minabuti po natin na isama po natin sa paglilisensya so that there will be standards na i-enforce. Because we know that COVID-19, highly transmissible, kailangan biosafety requirements are there kapag ginawa natin. Yun pong TB natin na programa dati sa paggamit ng gene expert natin, hindi po ganun ka tedious ang requirements. We did not require any biosafety equipments and infrastructure. Pero for COVID-19, we have required this because this is a highly transmissible virus. Kaya po, yung lahat ng safety standards pinatupad natin, kaya kailangan lisensyahan ang mga gene expert RT-PCR laboratories. So that is not bureaucracy. That is not bureaucratic red tape. That is ensuring safety for the population and our healthcare workers.
Thank you po, Yusek, for that clarification. The next question from Greg is that more than a week after the de-escalation of alert level in Metro Manila to 3, do we have initial assessment on our gains? And what's the DOH reaction on the thousands of individuals that went to Dolomite Beach over the weekend po?
Yes, no? So as I answered it a while ago for the Dolomite Beach, nakikiusap tayo sa ating mga kababayan, no? Na sana po tayo po ay magtulong-tulong. Gusto na ho nating bumunta doon sa sinasabi nating new normal. Para po tayo makarating dyan sa new normal na yan, kailangan lahat tayo magtutulong-tulong. Kailangan lahat tayo magko-comply sa safety protocols. Hindi po namin inaalis sa inyo na gusto nating pumunta sa mga lugar katulad nitong Manila Bay para po tayo makapagpahangin, para po tayo ay magkaroon ng sunlight, magandang mga tanawin, okay lang po yun. Pero pag nakita na ho natin na maraming tao, baka schedule na lang natin sa ibang araw na kakaunti lang ang tao para hindi po tayo nagkakaroon ng risk to be infected o mahawa kayo sa sakit o makapanghawa rin po kayo. Tinanawagan pa rin kami sa ating mga kapwa national government agencies and to our local governments. Sana po ipatupad po natin kung ano po yung mga safety protocols natin. Katulad ng lagi nating sinasabi, hindi pa ho tapos yung laban, nandito pa ho yung virus. Kailangan po tulong-tulong tayo. Huwag tayong maging kampante, maaring lumabas, pero kailangan mag-iingat pa rin tayong lahat. As to the other question, yung sa de-escalation to alert level 3, patuloy po ang pag-aaral natin dito sa National Capital Region. Katulad ng nasabi natin in the previous week, nag-improve po ang ating mga indices, yung mga indicators natin ay nag-improve kaya tayo ay napunta sa alert level 3. So ang binabantayan po natin ngayon for the National Capital Region, ito pong kanilang average daily attack rate. This means the new cases that are affecting the population for that specific time period. Kasi ngayon po nasa 8.89 pa ang NCR, kailangan bumaba siya to 7 or below so that we can further de-escalate itong National Capital Region. Sa mga ospital naman, binabantayan pa rin natin kasi katulad natang sabi ko, meron pa rin pong mga ibang ospital na meron pa rin hong marami na naka-admit sa kanila. And in fact, sabi ko nga, yun pong isang city dito sa NCR, more than 70% pa ho ang kanyang ICU utilization. So binabantayan natin lahat. We are keeping track of their indicators. Magbibigay tayo ng information maybe by next week because that's adequate time already for us to be able to assess.
Thank you po, Yusek. Next question is from Lealdis po of GMA. Kumusta na po ang utilization ng 400,000 Moderna doses nearing expiry from the private sector po?
Yes, no? So nagkaroon tayo ng policy, yung pinaliwanag ko nung Friday yata. or Saturday sa Laging Handa, yung policy natin, yung loaning ang tawag. So naipalabas na yan, napirmahan na, ibig sabihin ang private sector can do this kind of arrangement with the national government. Kung meron po silang pinangahawakan ng mga bakuna na near expiry na, pwede nila yan i-loan sa national government, magkakaroon lang ng agreement, at pag dumating na yung panahon na kailangan na nila, papalitan po natin para lang hindi masayang yung bakuna na hawak nila. So with that kind of agreement, we were able to get 356,000 Moderna doses from the private sector, at ito po ay pinamahagi na sa Regions 4A and Region 3 para magamit na po natin. At yung sa private sector naman na pinagkuhanan namin, papalitan natin yung doses na yan kapag kailangan na po nila talaga.
Thank you po, Yusek. The next question of Lay is, naka-alerto na po ba ang DOH sa Delta subvariant na pinangangambaang posibleng mas nakapanghawa po?
Lay, we have responded to this numerous times already, no? So sinasabi nga ng mga eksperto and even evidences, no, internationally, hindi pa kumpleto ang pag-aaral dito sa tinatawag na sublineage nitong Delta variant. So kailangan antayin natin, ano? So sa ngayon wala pang kumpleto, hindi pa rin siya variant of concern, hindi pa rin siya variant under investigation. Isa pa lang pong pag-aaral ang ginagawa ng WHO regarding this at saka yung iba pang mga eksperto. So ngayon, kung ano man mga protocols ang pinapatupad natin, kung ano man mga public health standards for safety ang pinapatupad natin, lahat po yan epektibo sa kahit na anong variant ang meron tayo dito. So patuloy lang natin gawin yan, and of course, border control is very important.
Thank you po, Yusek. The next question is from Joanna Lee Casilaw of GMA News Online. Hingi lang po sana kami ng comment from DOH on the slight increase of the COVID-19 reproduction number in NCR.
Yes, no. So Joanna, we did not note of any increase in the reproduction number in NCR. Currently, as of October 11, ang ating reproduction rate is 0.723. Ang October 4 to 10 natin is 0.76 to 0.73. So yung pong current natin na reproduction rate, we did not note of any increase at all. Actually, it's a little less, no? Medyo bumaba ng konti lang. Kasi dati 0.76, ngayon ay 0.72. So hindi po tayo nagtaas ng reproduction number dito.
Thank you po, Yusek. Next question is from Red Mendoza of the Manila Times. Senator Francis Tolentino said that the DOH can require mandatory COVID-19 vaccination for school-age children. Ano po ang reaction niyo dito?
Pinag-aaralan po natin yan sa ngayon. Ano? So isa-isa lang po, lahat po ng ating eksperto mobilized para pag-aralan lahat. Although meron na ho talagang emergency use authority coming from FDA ang 12 to 17 years old. Pero pag tinawag ho natin kasing school-age children, kasama po dyan yung less than 12 years old. At yan po ay patuloy na pinag-aaralan, at sa ngayon po wala pa ho tayong bakuna dito sa bansa natin na may ganyang EUA for less than 12 years old. So we will wait for that at titignan po natin kung ano po ang maya-advise ng ating mga eksperto.
Thank you po, Yusek. I will now be moving on po to the Zoom chat questions. So for the first question is from Sheila Crisostomo po. What is the B1.1.318 variant? Is this the Delta Plus variant? May we get more details po? Same question with Mads Villar. Hi po, can we get more details about B1.1.31 variant po? Bakit po siya kasama sa variant under monitoring?
Yes, no? So when we say it's variant under monitoring, kasama yan doon sa mga classifications ng WHO. So this is a variant under monitoring as announced, no, as classified by the World Health Organization. Ang kanyang date of designation ng WHO last June 2, this was initially identified or detected in Mauritius. Meron silang naging cluster of 120 cases doon, at nung kanilang nag-sequence ay ito po ang lumabas, itong variant under monitoring na ito. It has 14 mutations in its spike region. Kasama po dito yung mga mutations na nakita rin natin sa Delta variant at sa Beta variant, yung E484K, meron din Y144Del and P951, at yun pong para sa viral transmissibility na P6818. So ibig sabihin, pinag-aaralan po ito maigi ng WHO, ng mga international experts, Dahil ito pong mga mutations na ito ay maari makaapekto rin sa ating efficacy ng bakuna, maari rin po makapag-apekto sa transmission ng sakit. Pero sa ngayon, wala pang kumpleto. Minomonitor pa lang siya, kaya ang pangalan ay variant under monitoring. We were able to detect a case here, katulad ng nai-report po kanina sa presentation, 34 years old male. Yung kanyang sample ay retroactive. Nakuha natin noong March 10, 2021 pa from the Philippine Red Cross Laboratory. Meron siyang travel history sa United Arab Emirates, sa UAE. Dumating siya sa bansa March 5. Ang kanyang date of recovery was March 21. Ang local address niya is Bacolod City, Negros Occidental. So again, let me just reiterate, it's a variant under monitoring. Lahat po pinag-aaralan sa ngayon. Wala po tayong cause to panic. Kailangan lang po maging vigilant pa rin tayo lahat and follow our minimum public health standards.
Thank you po, Yusek, for that clarification. The next question po is from Aiko Miguel of UNTV. FDA said na wala pa rin daw po pharma company or manufacturer na nag-manifest to apply for an EUA para ma-amend ang existing EUA nila for third or for booster dosing. Will the Department of Health apply for EUA of COVID-19 vaccines that will be used as third dose or booster doses? Kailan po natin ito target gawin? FDA said this is allowed po, lalo kung vaccines will be used for heterologous vaccination and for mixing and matching po.
Yes, no. So Aiko, ang Department of Health ang mag-a-apply ng Emergency Use Authority sa Food and Drug Administration. So nakapagpadala na po tayo ng initial na sulat sa FDA on our intent to apply for this Emergency Use Authority. So na-submit na po natin yan sa Food and Drug Administration. Ngayon po, nagkakalap tayo ng makumpleto natin ang mga documents requirement, no, kailangan para sa FDA. Kasama dyan yung mga evidences to support that this kind of practices, katulad ng third doses or boosters, are safe and it's going to be effective for the population. So kinukumpleto lang natin, and hopefully we are trying to facilitate para po maumpisahan po agad kapag nagkaroon na ng EUA ito pong mga bakunang to.
Thank you po, Yusek. Another question from Caroline Bonkin. Clarification po sa genome sequencing. Why were the samples from March and April only sequenced recently po?
Yes, Caroline, no? So meron tayong tinatawag na retroactive, retrospective na sequencing para makita natin saan nagsimula itong mga variants na meron tayo sa ngayon. Kung matatandaan nyo, katulad ng Delta variant, we initially detected ito pa of parang late May na, no? So gusto natin malaman in the previous months ba prior to May, meron na ba tayong detection ng mga ganitong variants para po na iaayos natin ang biosurveillance natin. As to bakit ngayon lang kasama makatulong sa epidemiologic and phylogenetic analysis. Tama yun, Caroline. So we do that for us to be able to further analyze at makita po natin kung paano natin maisasama yan dun sa mga response na ginagawa natin ngayon.
Thank you po, Yusek. The next question is from Lee Alves. Ayon sa WHO, nasa endemic phase na ang COVID-19. Handa na ba ang DOH dito?
We have not received that kind of information from WHO yet, no? Usually, if there are this kind of announcements, they officially communicate to the Secretary of Health. So we will wait for their official letter. But as to endemicity, kailangan hong pinaghahandaan ng ganito, no? Because once an organism becomes endemic in the population, meron po tayong mga ibang steps na ginagawa, especially about surveillance. Pero sa ngayon po, mukhang hindi pa ho natin madideklara talaga na endemic na siya, no? Kailangan po natin pag-aralan maigi, lalong-lalo na nagmi-mutate itong virus na to every so often. So kailangan marami ho tayong factors na kino-consider before we consider an organism or a disease to be endemic in a country.
Thank you po, Yusek. The next question is from Tina Paganiban Perez po. On family reunions, parties, trick or treating, ano ang mga dapat gawin para walang infection or better bang no reunions or parties at all po?
Yes, no, so Tina. So unang-una, alam po natin na hindi naman po natin maiiwasan na magkaroon ng mga gatherings na ganito. Lalong-lalo na parating po itong ating Kapaskuhan. Pero ang tanging paalala po natin, alam po natin lahat what would be safe and what is not safe. Nagpaalala na tayo, pag tayo ay nasa enclosed setting, the 3 C's, na andyan po yung highest probability of getting infected and infecting others. So sana po kung magkakaroon tayo ng mga ganitong handaan, pagsasalo-salo, unang-una, let's maintain our family bubble. Ngayon, kung hindi talaga maiwasan, may ibang kamag-anak na kailangang makita rin, alam natin na kailangan lagi nakamask, may physical distance, kung maaari gawin po natin sa labas ng bahay. Yan po ang pinakamagandang pwede natin gawin para hindi po tayo kulog na kulog sa loob ng ating mga tahanan. Ang gusto ko lang ipaalala sa ating lahat po ng ating gagawin mula po nung tayo ay na-de-escalate to alert level 3 and maybe if we get de-escalated to a much lower level, nakasalalay po sa atin lahat kung babalik po tayo uli dun sa pagkahigpit at pagtaas ng mga kaso at maraming nauuspital. So sana po tulong-tulong tayo. We can always have the parties. We can always have this kind of activities. At kailangan magtulungan tayo. Kailangan ipatupad natin yung mga safety protocols para patuloy po nating maranasan, ma-experience uli yung ating dating kinakagawian ng mga activities.
Thank you po, Yusek, for those reminders. The next question is from Miguel Aguano from the GMA News. Is the DOH worried over PUVs being jam-packed with passengers? What should be done po?
Yes, no? So, alam nyo, meron ho tayong mga minimum public health standards for all types of settings. Kasama po dyan ang transportation. So, ayan po ay naibigay na rin naman po natin sa Department of Transportation. Actually, meron silang 7 commandments no, na pinapatupad sa DOTR para po sa mga pampublikong sasakyan. So, nananawagan tayo uli sa ating mga commuters na sana po kapag kayo ay sumasakay ng pampublikong mga sasakyan, let us all remember yung 7 commandments, yung bawal ho kayo magtanggal ng mask at face shield, bawal po kayong kumain, wag muna ho kayo makipagkwentuhan pag nasa loob tayo ng mga public transport, tayo ay mag-maintain ng physical distance. Kapag nakita nyo po ang isang pampublikong sasakyan na punong-puno, huwag na ho kayong sumakay. At yung probability po na kayo ay magkaroon ng infeksyon o makapanghawa kayo ng infeksyon ay napakalaki po. The Department of Transportation knows at alam po nila kung ano po yung mga minimum public health standards, and we trust that other national government agencies would be implementing this so that we can safeguard ito pong pagtaas pa uli ng mga kaso dito sa ating bansa.
Thank you po, Yusek. The next question is from Gerard Naval. May we ask for comments of the DOH regarding several political gatherings and motorcades that happened in recent days? Are such activities advisable na po given the continued threat of COVID?
Meron naman tayong mga pwedeng gawin para magtuloy ang mga activities na ganito. Katulad po ng mga pag-uusap namin sa IATF, alam naman po at recognized po yan ng ating mga national government agencies. In fact, COMELEC has been using our omnibus guidelines on minimum public health standards dito sa mga ginagawa nilang activities. Ang kailangan na lang siguro talaga would be the enforcement of these protocols. At ang DILG naman ay naka-alerto ukol dito sa mga to, pinapaalalahanan ng ating local government. So nagpapaalala tayo uli sa ating mga LGUs, sa ating po mga officials na tumatakbo, na sana po sa atin na po manggaling na that we are responsible para po hindi magkaroon ng crowding or gathering every time that we have this kind of activities. Meron ho sana tayong mga regulasyon para ipatupad ang mga local governments para hindi rin po yung ating mga constituents ay nagkakaroon ng pagkakahawa-hawaan dahil gusto po nilang makita ang ating mga kumakandidato.
Po, Yusek, from Caroline po, may nakikitang pagtaas ulit ng kaso sa Lubang Occidental, Mindoro. Nalaman na po ba ng DOH ano ang dahilan?
Yes, Caroline, so they're doing active case finding currently in Lubang. Kaya talagang biglang taas ang mga kaso. So this is a result of the active case finding at maganda yan dahil immediately ma-isolate nila yung mga taong may sakit, and then after 14 days, we hope that the number of cases in this area will continuously decline.
Thank you po, Yusek. If you have the data po now, Yusek, we have several questions from the media regarding po anong vaccine brands ang i-apply ng DOH for the EUA po for booster and third dose po.
Pinag-uusapan pa to, we are finalizing the discussions. We have a meeting with our all experts tomorrow afternoon, and we will soon know pagkatapos na pakikipag-usap sa ating mga eksperto.
So I think that's all the questions we have. Salamat po, Yusek. And for your final message po to our kababayans.
Yes, no? So thank you very much, Jolo. Bago matapos ang ating media forum ngayong Lunes, gusto po namin magpasalamat sa ating mga media partners. Alam po namin kayo ay katulong namin sa pagpapakalap ng tamang impormasyon sa ating mga kababayan. Sana po patuloy niyong suportahan ang kagawaran ng kalusugan dito po sa ating objective to inform and to give accurate and reliable information to everybody. Bagamat po na nakakakita na tayo ng pagbaba ng ating mga kaso nitong nakaraan at alam po natin na sabik na tayong lahat lumabas at bumalik sa dati nating nakagawian ng mga activities. Pero sana po wag po tayong maging kampante. Sana po tayo ay laging focused, lagi tayong aware na lagi po nating gagawin ang ating mga dapat gawin for safety. Lagi natin po isusuot ang ating face mask at face shield ng maayos. Palagi ang mag-ugas ng kamay, palagi ang mag-sanitize ng kamay. Umiwas po tayo sa mga crowded na lugar, yung mga 3Cs, yun pong close settings, crowded settings, at saka yung merong probability of close contacts. Tsaka sana po, kapag kayo ay nasa loob ng enclosed space, huwag niyo pong hubadin ang inyong mask at face shield at sana bukas ang ating mga bintana so that there is adequate ventilation. Patuloy po ang lagos ng hangin. Atin po laging isa sa isip at isa sa puso. Ito pong mga bilin namin sa inyo na bagamat alam ko kulit na kayo, pero ito lang ho makakapagprotekta sa atin. Pagkatapos na ng minimum public health standards, magpabakuna po tayo kapag eligible na tayo. These two strategies, no, ito po ang makapagliligtas sa atin at makakapagdala sa atin doon sa ating tinatawag na new normal. Sana po magtulong-tulong po tayo lahat. Huwag muna po tayo maging kampante. Tayo po ay sumunod muna sa ating mga safety protocols. Maraming salamat po sa inyo. We will see you on Friday. Thank you, Jolo.
Thank you po. See you on Friday.